you very much. It's very nice to be here. I'd like to start my presentation thanking the scientific committee from that conference, that meeting, for selecting my name and inviting me back there to Brazil and, fly here to share with you my topic. So, during this 20 minutes presentation, I will share with you a protocol, a smile analysis protocol called 10 Commandments of Smile Aesthetics. So, that is pretty much like a 20-hour slide. This is my city, that you guys can see here. That's Bahia, the state. The capital of Bahia is Salvador. So that's pretty much was a flight, two legs flight, Salvador to Sao Paulo, and then Sao Paulo in a non-stop flight to Dubai. Currently, I combine my work in a private practice, and also I teach in the university back there in Brazil. And 2 times a year, I fly to UCLA in the US, where I spend 2 weeks, generally in March and then in November, as a visiting professor. And today I will discuss with you, I will share with you these 10 commandments of Smile Aesthetics. We published the paper last year in that Brazilian journal called the Enterprise Journal of Orthodontics. So this is pretty much our 10 commandments, actually 10 topics or 10 aspects that discuss or talks about Smile Aesthetics. And the first key question is, why Smile Aesthetics? So we are dentists, we are dealing with an area that is probably the most important area when we talk about aesthetics. So when we focus on that video here, we directly our attention to 2 specific areas. So the areas here is the eyes and the mouth. And the main reason is the color difference, the dynamics, and all those beauty that is related to the mouth and the eyes. So we can use an expression called smile dominance. So when we evaluate a face, the most important area in the face is the smile. And I was with 2 friends here, one from Italy and the other one from Colombia. We were, before the presentation, talking about nice things, scientific and about life also. And we were talking about how important we are as a dentist. And one of the reasons is that we are dealing with the most important area in the face, which is this mouth. So our patient is looking for aesthetics, yeah, that's true. And when they come to our office, they are leading or they are looking for some improvement in their smile aesthetics. So I'll share with you our 10 topics or our 10 commandments. The first one is related to an area which is the most important area in a smile, the upper centrals. So if you evaluate this patient here and check the photos, these are, occlusion, it seems to be pretty good, but the upper centrals, we have 2 aspects here. And the first aspect is proportion, and the second aspect is symmetry. And if you appreciate this layout here, you're going to see that there's no proportion when we talk about one central, and also there's no symmetry between the right and left side. And if you check the literature, the ideal proportion from one central is between 75 and 85%. And the question that we had a couple of years ago was, are dental symmetries really an aesthetic? So what we did, we tried to measure it, and we established a research protocol, and we published this paper in the American Journal of Orthodontics, and we selected 2 pictures, one a white and another one black female patient, and we created some asymmetries. So if you check these photos here, you're going to see some asymmetries in the centrals and laterals incisor edges. So we did that in a white female, also in a black female patient, and the findings is really interesting, is that when we're talking about centrals, if you have a very small asymmetry or incisor tooth wear, even if it's a 0.5 millimeter, this is considered unattractive for even orthos and lay people. So if you have a patient that after the ortho treatment, if you have a minor asymmetry in the incisor area, you go ahead and do it. You go ahead and treat it and correct the asymmetry, because lay people will see that. So to fulfill the first commandment, symmetry and proportion, it's very easy. We need a caliper so we can measure it. We can do some interproximal reduction. We can do some cosmetics. In that specific case, we did some interproximal reduction. After that, this is pretty much the final result. And then we referred the patient for some cosmetic restoration. And this is pretty much the before. And this is pretty much after the ortho. And this is pretty much after the restoration. And now we have proportion, we have symmetry, and we have a good smile. This is the before and after. Of course, this is a multidisciplinary approach, so there's a lot of people working in the cases. So the second one talks about the proportion, but not the proportion between the centrals. Now we are talking about the proportion between the centrals, laterals, and canines. And if you look back there in 1978, so this guy, Dr. Levin, he started to use the golden proportion in dentistry, in prosto. So the golden proportion says that when you evaluate in the frontal view, all teeth from the central to the left and right sides, they will have pretty much like 62% of the width. Thank you very much. I was thinking left. The width. Thank you about that. There's pretty much 62% of the width from the adjacent teeth, which is when we talk about the lateral, it's central. When we talk about the canine, we're talking about the lateral. But this is pretty old. We're talking about 1978. So recently, in 2007, those guys here published this paper in the British Dental Journal, and they found in a research that 67% or 72% it's more aesthetic. So we're talking about, in other words, that there is a general inclination to prefer the wider lateral incisor over the narrow ones. So the bottom line is that you can keep using the golden proportion, but you can also use a different proportion, which is a 70% or even a modified proportion. So this is pretty much the case here. Let's look back again. We have a lateral open bite case, but if you look closer, you're going to see that the laterals are a little bit narrow. So this is pretty much after the ortho treatment. We left some spaces in the distal aspect. After the restoration here in the right and left side, and after the final result, now we have a better, aesthetically speaking, smile. The before and after, the lateral will increase the width. Now the smile fulfill the second aspect, upper, lateral, and canines proportion. The third one talks about anterior spacing, diastemas. So we published this paper in 2003. This is pretty much like a 12 years old paper. This is a very simple anterior crossbite. We did some things we do in the undergraduate program. Some springs in the upper, removable appliance. We correct that, and that's pretty much the final result. So the question here is a midline diastema unattractive? Sometimes we think about that. Well, do we like that? As an ortho, I feel like I want to close all anterior spacing. So if you evaluate the literature, or even the chief complaint, which is sometimes even more important than the literature, but in the literature we have the information that 96.6% of the examiners prefer this smile without diastema. So we have the scientific evidence that we can go ahead and close all of them. And we did another research that the question was, how about if the diastema is in the lateral area, upper lateral area? So we published this paper in the Journal of the World Federation. And the result shows that an ideal smile should not have any diastema in the aesthetic zone. So if you are doing a aesthetic treatment planning, you should close all spaces. The exception is all those situations that your patient has a chief complaint or wants to leave a space. I have some patients in Brazil, it's funny, because I want to do treatment, but keep this space. Oh my God, are you sure about that? Yes, this space it's like a brick money or something about that. So we need to respect it. And back into the case, this is a before, did some restorations here. And this is before and after, a simple case after the result with composite resin, a very nice result. That's the before and after. After correcting the anterior crossbite and also closing the diastema with the composite resin. This is the before and after. Now the fourth one is smile arc or vertical position of the central incisors, excuse me. So when you evaluate this case here, you can see that the line from the lower lip is not coordinated or does not follow the lines from the upper incisors and laterals and conics or upper anterior teeth. So our brain does not like that. We kind of try to match those two lines. And this is pretty much the definition of a smile arc. So if you evaluate this picture here, you can see that upper anterior incisor edges perfectly follow the lower lip, which is defined as the perfect smile arc. So this is the question here is, why did the first photo, why the first one is totally different than the second one? Why I'm telling you that the first one is a beautiful smile and the second one is not a beautiful smile? And the question here, we need to go a little bit further so we can think about the answer. And if you guys check in the Hollywood pictures, the supermodels pictures, in the magazine pictures, and you evaluate those famous actresses, we're going to see that there is a perfect smile arc. And so the upper centrals, they are in charge of the smile. When you check, when you see those supermodel smiles, the upper centrals is the area of dominance. So the upper centrals is the dominant area in the smile design. There's another one here, which is a famous worldwide, Angelina Jolie, and then we can evaluate how perfect the smile arc is. And the answer for that question is that we are talking about youth. We are talking about youthness. So the more upper central, the more exposed the upper central is, the more you feel that this person is it's youth, it's younger. Because when we grow, all the tissue surrounding will go a little bit down, and then you're going to expose even less upper incisors. So the question here is still standing, what is the most pleasing vertical position of the upper central incisors? We did another research, and we published that research in a esthetic journal, not an author journal. And we did the same we artificially modified the upper central's position, intruding and extruding the upper centrals. And the answer for that question is that when you extrude the upper centrals a little bit, the smile becomes more pretty. But on the other hand, when you intrude the upper centrals, the smile becomes a little bit worse. So when you are trying to modify the vertical positioning of the upper centrals, we need to pay attention not only the function, the mandible function, but also we need to pay attention on the smile aesthetics. So the answer or the result from our study indicate that slightly extruded upper central are more aesthetically preferred than intruded. Let's come back to the case. So that's the initial photos from the case I showed you before, so we could understand and define the smile arc. And what we did, we modified the bonding protocol so we can extrude the upper centrals. And it's okay to extrude it with a very light force, and so the periodontal will follow them. When we compare the before and after here, we can see that now at the final result, we have a perfect smile arc design. I know that the case is a little bit more gingival, but it's okay because we are working within the limit that I will show you in a couple of slides that this is about 3 millimeters. Now we are talking about the fifth one, which is gingival margins. And let's evaluate this case here. Well, we have a lot of things to correct here. This is pretty much like a puzzle. We need to correct that scenario here. We published this case last year in the Brazilian journal. This is the occlusion photos. This is a crowding patient. We removed 4 premolars, first premolars. We started to close the spaces, segmented mechanics, pretty much done, almost done. This is after ortho. This is not okay. If we compare, we did improve the case, but it's not perfect. The occlusion seems to be better. We had an open bite that was a completely open bite from the second premolar to one side to the other side, but it's not okay, it's not perfect. This is the before and after, maintaining the arch form, before and after some restorations, before and after again, and then we evaluate the smile and ask, well, is it better? Well, it is better. But better is not perfect. We need to, at least, we need to try to improve it. The smile arc is very well defined. But if you come back to the basics, which is the first commandment, we're going to stop at the proportion and symmetry. And then if we can compare, and if we can overlap those photos here, we're going to see that we need some improvement. And we refer the patient from gingivectomy and also from some restorations. And that's pretty much the final result. Now we have proportion, we have symmetry. Gingival margins are very well established, and this is the final result. Now we can say that we did improve the case in all smile aesthetics aspects. And this is pretty much the before, after the ortho, and after the global ortho treatment. It's pretty much like, I have 3 minutes? 3 minutes? Okay, I'm almost done. The question is, gingival smile unattractive? When we talk about gingival smile, we need to tag the literature, and we did that. These are 2 research we published. This is a resident from our university, and the limit, when we talk about the threshold, is 3 millimeters. If we have more, the case is going to be like unattractive. So this is a deep bite case. We published that in 2009. This is after the ortho treatment. And this is the before, and this is the after. We did intrude a little bit, but keep in mind, maintain the smile arc. This is the before and after, and this is the before and after, with a nice result. The buccal corridor is that area here in the right and left side that you can see in the yellow circle. And the literature is a little bit controversial. There's some controversy in the literature that talks about buccal corridors. But that's the case here. We have some crowding, some space problems here. We expand. We did some expansion and also some projection in the AP position. This is pretty much after the ortho treatment. And this is the final result. Now we have a buccal corridor more position than compared that scenario before. We're pretty much there. That's the dental midline. And the key question here is that if you have a deviation in the dental midline, will people see that? So when you see the literature, there's a 4 millimeter threshold. So the midline is not actually a big deal. But when we're talking about a long axis deviation, now we need to pay attention and correct this. So that's the key problem here, angulation, not only a midline deviation. We did some mini screw here to intrude the right side here so we can achieve a better result. Almost there. 9 is detailing. So this is a simple case with a minor crowding case, some problems there with line leveling, and this is pretty much almost there. So check carefully. In a close-up view, we need to correct the contact point, some papilla problems here, so we need to reshape. We do some reshaping so we can modify the contact point. So this is pretty much close-up view. We need a 50-50 contact point. So we did some enamel reshaping so we could achieve a better contact point in a better smile analysis scenario. In the very last one, it'll be done in 10 seconds, we're talking about lip fullness. So this is pretty much in a case, in a class 3 case, the smile is not okay. We did some expansion, AP modification. This is before and after, a very nice result. But the problem here is that the patient did not like it. So she was kind of, Andre, please, I'm not happy. But she was not happy not with the smile. She was not happy with this. So the key question here is that she wanted a more pronounced, a more fullness lip. So we did some filling with some fillers, not myself, but the dermatologist did that, and this is the before and after. Now the smile is perfect, I agree with that, and now after the lip augmentation, the overall result is pretty alright. This is the before, this is after the treatment, and also after the fillers. Now the global result is even better. So during this 20 minutes and 30 seconds time, we talked about our 10 commandments, which is a smile design protocol. This is my contact, this is my email, my YouTube channel, my Facebook account. So whenever you are, willing to come and visit Brazil, it would be, my pleasure to, have you with me there. Thank you very much for your appreciation.
Thank you very much, Andre, for this very nice and amazing results, I should say. Okay, any questions?
Thank you. I think it was a great presentation. I have a question for you. When you were discussing your cases, I saw that actually the lip form, the upper lip form, you have chosen only one type of upper lip form, because we know, of course, that aesthetics, as different upper lip forms are present during the smile, your treatment planning can be different. How do you plan your treatment basing on the upper lip form, and what do you think of using for gummy smile treatment at the end of treatment? Because of course we know there's a limit. The use of botulinum toxin. Thank you.
Thank you for the question. Yeah, that was one key aspect: lip form, lip anatomy. So basically, you have 3 types of lip: upper lip. One is a flat, the other one is a curved, and the other one is uncurved. So what we need to do, what we do in my university, in my office, we do a digital smile planning. So we get a picture, put in the PowerPoint or Keynote, and we can draw with some tools, and then we can measure with a patient measurement, like upper central width, and then we can incorporate that number into the computer, so everything we do in a patient will be pretty much the same in the computer. So we can draw the upper and lower lip form, and then we can do our treatment planning. Intrusion, extrusion, that's pretty much what we do. But this is a very, very important aspect to evaluate. So the answer for your question is, that's a randomly, I don't know, I mean, I think it's curiosity. There's no actually a reason that I picked that form. There's no actually a reason. And the second aspect, some cases, if the etiology of the gum smile, it's the hyper muscular problem, not actually vertical dimension, not actually dental extrusion, we can definitely go ahead and use like Botox. So we can modify the muscular modification or movement. That's a very nice comment. Thank you very much.
Okay, Andre, it's a pleasure to give you this certificate for this nice and refined results.